so many times we will take something and then dial it back because we don't want to sound sensational. If it is sensational, it is sensational. And then you should report it. So many times in history, incredibly bad things happen because people can't believe something amazing is happening, either amazingly good or amazingly bad. So many people have something wonderful drop in their laps, and they will self-destructively destroy themselves to sabotage it, not believing that they could be successful. Plans for mass graves confirmed, government surveying cemetery readiness for flu outbreak. His article needs to get people concerned so that we can have a debate about this and hopefully stop whatever's coming, or at least be individually prepared for it. Because it's not my job to scare you, but when something is scary, it's not my job to say, is FEMA preparing for a pandemic? Question mark. Federal agency seeks 40-yard dumpsters for biomedical waste disposal during emergency. Well, I mean, they're preparing mass graves, they're preparing forced inoculations, they're preparing under InfoGuard, lockdowns, under clergy response teams. The church is saying, take your inoculations, go to the camp, it's of the Lord. That's on the news. They're expanding across the board, and their main mission is letting the foreign globalist offshore crime syndicate take over this country. But here it is, plans for mass graves confirmed, government surveying cemetery readiness for flu outbreak. And how to bury millions in Illinois, Indiana, New York. That's just 3 states we got documented.
Our experts here at the CDC and across our government agree that the chances of an Ebola outbreak here in the United States are extremely low.
There's a lot of evidence linking the development of Ebola, and when it first began to show up on the scenes the last 40 years, to Western bioweapons laboratories that were on the Gold Coast, the western coast of Africa. And then by 2002, tens of billions of dollars were spent for a program called BioShield. And under the cover of creating cures for biological weapons or treatments, they built bioweapons labs all over the United States, including in populated areas, despite protest, like at the University of Texas in Galveston, right where hurricanes hit, and didn't even put the deadly pathogens in containment facilities underground. They did it in level 2 facilities. That's just like bringing Ebola-infected patients to general hospitals.
My concern is that do we have a bunch of little time bombs walking around the streets of America that are going to suddenly explode, and we're going to suddenly start having cases? And it certainly doesn't help, like Dr. Davis suggested, bringing in infected people, because none of us really trained for dealing with this level of infectious disease. It's not commonplace for us to down up and deal with patients of this caliber.
New estimates by the U.S. Centers for Disease Control and Prevention are warning that the number of Ebola cases could reach 1.4 million by mid-January.
U.S. State Department orders 160,000 Ebola hazmat suits. Bulk purchases prompts concerns about spread of deadly epidemic. Centers for Disease Control and Prevention warned hospitals and doctors that now is the time to prepare. Obama says U.S. military to provide equipment, resources to battle Ebola epidemic in Africa, and now it could gestate for a lot longer period, making it more likely that it will end up getting into the United States.
Our efforts to help mobilize the international community to fight it, and the steps that we're taking to keep people here at home safe.
1 milliliter of Ebola-infected blood, if it is aerosolized, has the capability of infecting 10 million people.
Between the specialists they have on the ground in West Africa and here at headquarters, they've got hundreds of professionals who are working tirelessly on this issue.
In a speech to the United Nations member states at the beginning of September, MSF's international president signalled the failure of the current strategy for combating Ebola. No organisation, and that includes MSF, is equipped to deal with the explosion in the number of cases, the dozens of infected health workers, and collapse of the affected countries' health systems.
This is something that we take very seriously. As soon as there's an outbreak anywhere in the world of any disease that could have significant effects, the CDC is in communication with the World Health Organization and other multilateral agencies to try to make sure that we've got an appropriate response.
We have to stop it at the source in Africa.
Dr. Gottlieb, former Director of Medical Policy Development for the Food and Drug Administration, asserted that Ebola is likely to arrive in the U.S., and that if it does, the CDC will invoke powers to hold a healthy person against their will. Dr. Gottlieb also points at an executive order passed by Obama on July 31st, which allows for the detention of Americans who merely display signs of any respiratory illness.
The CDC has confirmed the first case of Ebola in the United States. Obviously, this is an unprecedented development. They admitted, they acknowledged that family members of the victim there in the Dallas hospital may also have been infected with the virus, as well as members of the community. And now we know that this victim, this Ebola victim, was active for several days with symptoms of the disease walking around the community. So the question remains, who else could have been infected?
Now to go back over those 4 days and figure out anybody that person may have had contact with. That's absolutely critical. It is absolutely crucial to do that to try and prevent other people from possibly spreading this virus.
Now they're saying 80 people are being monitored. This one person can affect up to 80 people. Meanwhile, the CDC wants to tell you that there's nothing going on, that everything's fine, there's nothing to worry about. Continue going to school, continue letting your child go out there. But the parents are saying no, the parents are pulling their kids out of the schools here because we know 5 children went to 4 of the local schools in the area.
We will contact anyone who we think has any likelihood of having had an exposure to the individual while they were infectious. At this point, that does not include anyone who might have traveled with him because he was not infectious at that time.
Why haven't the flights from West Africa been stopped from coming into America like Europe and France have done?
That's a question that's really not in my domain. We did not discuss that specific question.
People talk about, well, we shouldn't allow any flights in from Liberia. I mean, we in America, how dare we turn our backs on Liberia, given the fact that this is a country that was founded in the 1820s, 1830s because of American slavery.
We could be looking at hundreds of thousands of people infected with profound political and economic and security implications for all of us.
Michael T. Osterholm, director of the Centers for Infectious Disease Research and Policy at the University of Minnesota, acknowledged in a recent New York Times op-ed that virologists are loath to discuss openly, but are definitely considering in private the possibility that Ebola has gone airborne. Top German virologist Jonas Schmidt-Kansast caused consternation recently when he suggested that the battle against Ebola in Sierra Leone and Liberia was lost and that the virus would eventually kill 5 million people.
Dave, my mind is going. I can feel it.